Hi, Toby Kohler back again with Mayo Men's Health Minute from Rochester, Minnesota. Today we're going to cover penile implant pre-operative preparation. What questions should you ask 1 month prior to surgery? Okay, so here is a list of questions that you should discuss with your surgeon about 1 month ahead of the implant surgery itself. The first question should be, Doc, will my penis be shorter after the surgery? The answer should be maybe or probably. It should never be no, it will be longer. If that's the answer, run for the proverbial hills, as we say. As we discussed before, the penis never gets longer from this operation. It only stays the same size if you're lucky, or gets slightly smaller. That being said, we do several maneuvers to help mitigate the length loss from the procedure. 2 of them are listed in the bullets. The first is the use of a vacuum erection device. So you can talk to your physician about potentially using a vacuum erection device 4 to 6 weeks prior to the surgery to help condition the penis so that it's easy to put the implant in and so that the surgeon can put in as large a device as possible, but that is also still safe. This applies mainly to men who have not gotten good erections for a while and have not been using pills with any efficacy or injections, that type of thing. If you have new shortening or new curvature, this is definitely something you want to use before you get your implant surgery. Should I have a scrotoplasty? Well, a scrotoplasty is removal of excess skin. It's like the triangle of skin between the scrotum and the penis that occurs as a result of a circumcision. If you're not circumcised, you shouldn't get a scrotoplasty. However, if you are circumcised and there is some excess skin in that area, the surgeon can remove it at the time of implant closure and kind of like a magic trick, make the penis look longer. Now, remember, it doesn't actually get longer, but most guys are happier with this result. The next thing you should ask about is, should we address my urinary symptoms? Yes is the answer to this question. So if you have a weak stream or any other urinary bother, it's best to take care of this before you do the implant surgery. The rationale is that if you don't take care of your weak stream or symptoms and then you get the implant, you can end up not being able to pee after the surgery, something called urinary retention. That leads to having to keep the catheter in longer than we want and not only makes you miserable but also puts the implant at risk. The next question you should ask is, where will the reservoir go? Remember that the reservoir is the holding tank for fluid when the device is not being used. And so the surgeon has to decide where he or she wants to put it. It either gets put in the normal location next to the bladder or in the ectopic location, which is above the strength layer of the abdomen but below the musculature. The reason we put it in one location or the other depends on previous surgery and safety reasons. So if you've had previous hernia repairs or any other kind of abdominal procedures, make sure you let your surgeon know. If you do get an ectopic reservoir placement, it is not abnormal to see a slight bulge in that area. I tell my patients to consider it like a penile pacemaker in the area. Most guys are not bothered by it at all. Finally, if you have baseline penile curvature, you definitely want to let your surgeon know. If it's severe curvature, it's good to know ahead of time because there are several maneuvers that we can do ahead of time or during the surgery to help fix the curve. At the end of the day, we aim for a straight penis, not a straighter penis, not a perfectly straight penis. And so if you let us know ahead of time, we can help address both the problems with erections and the curvature simultaneously. All right, so there's a list of questions that you should for sure talk to your surgeon about 1 month before the surgery. Make sure you get all of these answered and addressed before you move forward. I hope you've enjoyed this video and found it useful. As always, if you have further questions, please call the number on the slide or email us at ipp@mayo.edu.